All right, I'm going to go ahead and kick it off and introduce our guests. First, we have Dr. Bill Rawls, who began his career in obstetrics, also known as an OBGYN, until sadly he contracted chronic Lyme disease in his late 40s. He was forced to leave his practice in order to get well, but upon finding his path to recovery, he started his current organization called Vital Plan. His practice is to help other Lyme sufferers be able to address their issues in a more holistic way that focuses more on herbs and supplements to help restore wellness. Additionally, we have Dr. Daniel Cameron. He is a board certified primary care physician and epidemiologist who has 30 years of experience as a clinician, teacher, and researcher. He was also a past president of the International Lyme Disease and Associated Diseases Society, aka ILADS, very similar to one of our previous guests, Dr. Robert Bransfield, who also held that role. In addition to this, he has done a lot of clinical and research work, but he's also been an outspoken advocate for Lyme disease patients and continues to provide support and testimony to legislative hearings and public forums across the country, urging policymakers to adopt laws that would advance the standard of care for patients afflicted with tick-borne diseases. And then lastly, we have Jennifer Hoffmann, who is a program associate with Project Lyme and a board member of our Generation Lyme initiative. Jennifer was diagnosed with Lyme disease and other co-infections back in 2017, and she was recently diagnosed with COVID in March of 2020 after being sent to the ER's quarantine room on the day that she went in for testing. She experiences some lingering symptoms from both diseases. So thanks again to all three of you for being here and being panelists with us. And thank you all to our guests for attending, and shout out to everybody who might be watching this via Facebook. Again, thank you all. So I'm going to jump right into it and get this started. So obviously there's a lot of conversation going on about the similarities and differences between COVID-19 and Lyme disease. So Dr. Rawls, I'm going to aim this question at you first, being what symptoms do the two diseases share in the short term and the long term? And are there any other diseases that you may have seen that show these similarities in symptoms?
Yeah, I think anytime you look at a chronic infection as opposed to an acute infection with a microbe, you're going to see similar symptoms. So an acute infection with a microbe is a microbe trying to break through the barriers of the body to get inside the body. And what the motive is to get at our cells, because our cells provide nutrients and protection and the things that we need. So most microbes that penetrate into the body infect cells. They invade cells because that's where the food is, basically. So you're going to see similarities because once they enter, whether it's breaking through the barriers of the lungs or being carried in on a tick bite or sexually transmitted, what we feel as those initial symptoms are just that war between the immune system and the microbe. But once they break through those barriers and hit the bloodstream, they disseminate throughout the body. And a lot of them use a Trojan horse mechanism of infecting white blood cells, and that creates a vehicle for them to be carried to the heart, to muscles, to joints, to brain. So a lot of microbes use that. In my research, I found well over 100 microbes, and I think that's just scratching the surface. So when you look at COVID, once it breaks through the lungs and hits the bloodstream, it can disseminate throughout the body. So at that point, it becomes a different war between the microbe and the immune system, that the immune system is using antibodies and targeted immune cells to take out cells that have been infected. So there's a bit of an autoimmune inflammatory phenomenon. Different microbes prefer different cells. So there is mild variation between like the Lyme co-infections, COVID, influenza. They all have slightly different strategies. But brain fog is very common. Muscle aches and pains are very common. Fatigue is very common with all of these things. And it runs over into chronic, we see these same symptoms in fibromyalgia, chronic fatigue syndrome that's often associated with Epstein-Barr. But again, every microbe has slightly different strategies, so you're going to see slightly different symptoms. But that's basically because they have very similar motives of infecting cells throughout the body, and they're basically just peppering all of our tissues, then you're going to see an overlap in symptoms.
That's very interesting, and I'm sure several of our listeners identify directly with several of those symptoms that you already mentioned. But as I said, we have a very large community, and this question actually came directly from the community, and I'll direct it to you, Dr. Cameron, is there any scientific evidence that supports that Lyme patients either are or are not at an increased risk of developing these severe or quote unquote long haul COVID symptoms?
There is a fair amount of research on people who have impaired immune system with COVID, and they just haven't done that microscopic level of what about Lyme disease. So we can really mostly focus in on the autoimmune diseases like lupus, rheumatoid arthritis. Sometimes those are overactive immune type problems. And then there's the underactive, like with chemotherapy or cancer or radiation therapy. So it's not clear how much it affects those broader categories where the big funds are going. You know, right now, those who are getting the vaccine offered are the classic risk factors like smokers, people over 75, people in nursing homes. But so the simple answer is that there's never enough data to feel comfortable with these autoimmune diseases or this overactive Lyme states, even chronic fatigue and fibromyalgia that we were discussing is not enough data, so I can't see a clear trial. I know from my practice is that I've had by now quite a few Lyme patients who have already gone through COVID, and just from that experience, they don't seem worse than their family members.
That makes complete sense. So I think this leads directly into an important question that I think everybody in our community is asking, which is, and I'll direct this to both of you, but first I'll go to Dr. Rawls, which are, what are your recommendations for Lyme patients on how to self-identify these symptoms and potentially the difference between them, and how are you as doctors personally identifying any differences that you might see?
Well, I think the upfront thing that's a signal is that respiratory symptoms. I mean, it's again, when we look at microbes, what microbes want to do is break through barriers. We have skin, we have the intestinal lining to prevent microbes from getting inside to our cells, basically. And the lungs are one of the weaker barriers. So, but the immune, they hit the immune system full head on. So we have respiratory symptoms. So, I think part of the tip off that COVID might be a factor is those initial respiratory symptoms. Though not everybody is having them, and there are certainly people out there with long COVID that didn't have that much in the way of respiratory symptoms. I've talked to patients who had mild respiratory symptoms, but had the change of smell and taste. They lost their taste and their smell. And so anything to get inside the body, that's what the microbes want to do, is get to our tissues. And we're finding that COVID actually uses the olfactory nerve to pass into the brain. And sometimes if they can take a shortcut and not have to go through that battle in the lungs, why not? Sure, they're going to do that. So I think it happens, but it's just, that index of suspicion of things, of having a relapse. I mean, all the years that I had Lyme disease, I could tell when I was getting a little viral something, because I was seeing patients in the office and exposed to various kinds of things. And, that would, you would know something's a little bit different. But when we look at this thing called chronic Lyme disease, I don't see it as an infection with a microbe. I mean, we pick up things throughout our lives, Mycoplasma, Epstein-Barr, so many things. And when you disrupt immune system functions, it's all of those things are flourishing in your tissues, not just one thing causing an infection. So it is a little bit different.
Now, Dr. Cameron, do you have anything to add to that?
Yeah, I'd like to focus for a minute, not on people who have been sick for years and have taken antibiotics and all kinds of dietary strategies, integrated medicine strategies. What really happens that I'm concerned with are freshly ill people this year since February. If they don't have pneumonia to warn them, this whole long hauler list and the Lyme list are very similar. So doctors keep ordering COVID tests. Every time someone goes in with a headache, fatigue, poor concentration, memory, the autonomic issues like lightheaded, sensory issues like they're sensitive to light, sound. And so the doctor focuses in on COVID. So they've had 3 COVID tests before someone says, by the way, look at a tick-borne illness. So I'm always concerned about the rush to COVID and overlooking a treatable disease, especially if they've only been sick this year and haven't been on any antibiotics. And I've already seen delays with the over focus only on COVID.
That makes complete sense, actually, and is a perfect segue into our resident patient here on the call, being Jennifer Hoffmann. Obviously, when you were originally diagnosed with COVID, it was extremely early on in the pandemic. So I'm sure it would have been very hard for you to self-identify at the time. But luckily for you, you had already been diagnosed with Lyme disease. So as someone who was diagnosed early on and already was previously diagnosed with Lyme, looking back, could you have possibly differentiated between what was causing your symptoms?
Sadly, yes. I mean, it's good and bad. I think if it had been, if my smell and taste have been the most affected, my most prominent symptoms, I probably wouldn't have noticed, or I would have chalked it up to a weird thing going on with me that day, kind of like being a professional patient, getting used to what it feels like to have a little bit of a virus or something like that. But when it came to my experience with COVID, one day I just started coughing and I didn't stop for like 2 months. And I had extreme shortness of breath, and there were nights when I thought, and I will say as a patient, I chalked that up to allergies for a good while, though I did quarantine myself because I'd been following the news, and my hometown was the epicenter of the outbreak over here, and I had just visited. So I didn't jump to that conclusion, but as my symptoms continued to worsen and they were different from my usual Lyme symptoms. I wasn't having that kind of struggle to breathe. I wasn't spending nights wondering if I would stop breathing during my sleep. And then I had other forms of body shutdown symptoms that had only happened when I was very, very sick with mono in college and told I might not make it. So I'd experienced that once before, and I knew that it was some kind of virus. And so I had those kinds of clues.
Yeah, thank you so much for sharing. And hopefully our guests here will be able to hear Jennifer's story and continue to make sure that you check yourself, know your own body, realize your own symptoms, and make sure you can address any issues as early on as you possibly can. But I'm going to go back to the doctors here, and this time I'll start with Dr. Cameron. But when it comes to, obviously, a majority of your patient base are long-term Lyme patients. After you have found out that an individual has either been exhibiting symptoms of COVID or actually been directly diagnosed with COVID, what is your process of managing that individual, either to bring in additional specialists or mainly just focus and double down on your current protocols?
Well, I because I'm fairly accessible, I have a tremendous amount of people that are new also. So who have been relatively well. and have escaped that chronic unending illness. So I have both types. Therefore, with anything in medicine, there's always more than one possible cause. So as an internist, just because COVID is a possibility, Lyme is a possibility, but there are other infections that I regularly have to use specialists. And when I break it down, if there's a possibility of a new infection with Lyme, and I think there might be a possible infection with one or a co-infection, I'll address that right away because it's new. If they've had some other strategy, more symptom management, I'll say, well, get back to whatever has worked before. And then, because I have an active practice where I have to take on the traditional medical role, that's when I have to look at cardiac issues that are beyond COVID, beyond Lyme, and whatever. And I often have to get a neurologist involved. So it continues to be a work in progress. And I also have people come back, because just because I have a visit, if I don't have a follow-up visit, I'm not going to get the outcome I want. So often I'll triage and add specialists by following up that patient. I don't like this one visit and off. They say they don't have Lyme, and they don't look past that and look at anything else. They don't have a follow-up visit. And I think they're missing the opportunity to stick with that patient until they get rid of that illness.
Now, same question, Dr. Rawls. What is your process of managing an individual who may be exhibiting symptoms of both these illnesses?
Well, I'll have to say that I have taken a very non-traditional approach personally. I struggled with chronic Lyme disease about a decade ago, almost 15 years ago, and had virtually every symptom of chronic Lyme disease, had neurological symptoms, had significant cardiovascular involvement, and just could not find antibiotics that I could tolerate. Ended up embracing an herbal protocol. And that served me well. It took time, but over several years, I was able to regain my life completely. So that has been the focus of my research over the past decade, is understanding chronic microbial illnesses and the value that herbs might have in these things, whether it's viruses, bacteria, protozoa. There are quite a few of them. So my emphasis is mainly focused on helping people embrace herbal therapies. And there are quite a number of antimicrobial herb plants out there. All plants make antiviral substances. Viruses are ubiquitous in nature. So every plant is producing antiviral substances along with antimicrobial, antiprotozoal, anti-yeast. So when you combine plants together, combine herbs, you get an overlap in benefit. So what you get from a particular plant depends on the microbes and the stress factors it's dealing with in that particular environment. So plants are solving problems with chemistry. They don't have a cellular immune system like we do. They have a biochemical immune system. So they're producing a robust spectrum of substances. So when you look at the antiviral properties of plants, it's not one thing. So when they've looked at the various different herbs that we've used, not only for this coronavirus, but also past SARS viruses, they found that various different plants inhibited viral replication, inhibited fusion of the virus with the cell membrane, inhibited viral enzymes of various kinds, inhibited the spike proteins that we're looking at. So they have a range of different properties. And so interestingly, the protocol that I use for Lyme disease, when I started researching long COVID and the herbs out there that had been researched for corona, there was a lot of duplication on the list. And so many of the things that I use for Lyme disease actually had cross antiviral properties for coronavirus too. And I've known that because I've used these things to combat viral illnesses for years. I mean, ever since Lyme disease, I just quit having colds because I just take extra herbs and they do great. Now, Dr. Cameron may not agree with my opinion there completely, but it's an experience that I've had that is valuable for me to share because the toxicity of herbs is very, very low. But everyday things like garlic and ginger have some pretty remarkable antiviral properties. Just last week, the government of Thailand issued a statement recommending that if people have coronavirus, then have COVID, that andrographis is a really nice herb. Well, that's part of our Lyme protocol. Andrographis is just this wonderful herb that has wonderful antiviral properties. So the list goes on and on. So we do have some really nice choices there. And many of them surprisingly overlap between Lyme and COVID. So I think an acute regimen for someone with COVID, typically I use herbs like andrographis, ginger tea, garlic, Japanese knotweed, cat's claw, Chinese skullcap, wonderful antiviral reishi mushroom, not only an antiviral, but an immune modulator that helps reduce that cytokine storm. Turmeric is wonderful as an anti-inflammatory. Throw all those things together and you can really do yourself some good. But are they a substitute when we have better drugs and vaccines? That we don't know, but it is something we have right now. And all of these things have a very, very low potential for toxicity. So I think it is something that we should at least pay attention to.
Yeah, that's definitely very interesting. And Daniel, Dr. Cameron, I would definitely be interested in hearing a little bit more as to your treatment protocols as well. But before getting on there, I wanted to ask a question specifically to you about the patients that you mentioned who you were treating with Lyme disease and you've now seen diagnosed with COVID. How many or like what percentage of your Lyme disease patients have you seen experiencing diagnosis with both illnesses? And then of those individuals, how many of them have then continued on and shown the long haul concept behind it?
Well, I've had maybe 50 patients that have been in contact with me that I know really well, who I've asked and to communicate with me, and so far that group hasn't gotten worse. Their Lyme didn't get worse, and their COVID, would last a typical 2-3 weeks. I had one of my patients, the sickest one I had, was out of work for a month, had respiratory issues. I convinced her to go to the ER at her worst, and because she was reluctant, but her oxygen was okay. The chest X-ray was fine, and she went home. So then since I write blogs, I asked my readers, because I'm only representing what I see, I asked my readers to take note of what they've seen if they've had both, and at least none of them have written that they've had more troubles than they would have expected from the COVID. So what I do is that I often am asked these drugs like, should I take hydroxychloroquine or should I take ivermectin? And New York is a funny place because if you're a practicing physician as an internist, there's all kinds of rules, laws, and medical doctors are beating up on medical doctors if you write some things like ivermectin or hydroxychloroquine. Like New York, you can't. So I can't get personal experience, but I can at least read what everybody else is reading, what's been published. And hydroxychloroquine has a little bit of a heart problem, so it's not completely as benign as one would like. The controversy is because the original research in Italy the design was poor. And there's been a little bit better design, but it's still, just like it's hard to get a Lyme drug through or a Lyme treatment through, it's hard to get consensus on how to take care of hydroxychloroquine. And ivermectin, there was a couple of papers recently that they can't clearly say it's good, but they can't say it's bad. So there's some flexibility. They do note that ivermectin itself, to really make it work, you have to have much higher tissue levels at such high levels compared to the test tube that you may not reach that level. So I can reflect as an internist how heavy the debate is between doing what you have or just try to do a support. Like if somebody's done, like Dr. Rawls said, if somebody finds a relationship that helps with all kinds of symptoms of Lyme, they should definitely stay with those. Yeah. Adding some other supplements gets tricky, and I'm get beat up as a doctor trying to figure out which things I can write in the state of New York.
Yeah, that's extremely interesting. And I want to follow that up mainly with a quote from Mary Beth Pfeiffer relating to ivermectin. She was quoted in a recent article that she actually wrote herself, stating withholding ivermectin as a treatment for COVID-19 has entered a new realm. It cannot be defended as medically or morally principled, which I know you personally have not had that experience with it, but I just wanted to share that quote with people who are on this program at the moment, just to know that there are other people in the Lyme world who know that there has been some efficacy, and it's at least worth the opportunity to move forward with it, even if in some locations, like you said, Dr. Cameron, here in New York, you might not legally be able to. So I wanted to swing back to Jennifer here for a second, just because herself has had this experience with Lyme and COVID. And I wanted you to expand a little bit more as to what happened to your Lyme symptoms post-COVID.
Thank you for asking. Mine went completely haywire. So I would call myself someone whose Lyme got worse, or whatever the official term is for that. That is what ended up happening. Because I had some of these symptoms that seemed so specific to a virus that I hadn't had previously. The symptoms that kind of followed it in the month and so on after that initial wave, they really confused me, because I had all of the symptoms that I had dealt with for years and I thought I had gotten past me came back in a pretty raging way, and then some. Brain fog doesn't really cover it. Fatigue and exhaustion doesn't really cover it. My brain went back on fire. I had a very severe neurological case of Lyme disease not that long ago, but I had overcome certain hurdles. And then I found myself having a tremor again, and having like a tick again, like not that kind of tick, hopefully. But the shortness of breath, and my hair started falling out. And I understand from my own experience that my environment might have made a difference. All of the things that I already had going on in my body would have made a difference. But once I described this sort of flare to my doctors, multiple, they all said, this is that cytokine storm that everyone's talking about. And I have not, and this was a long time ago at this point. I got it in the beginning of March. I have not completely overcome that hyper inflammatory type of response. And I'm guessing I'm not the only Lyme patient who has had this experience after COVID. And so that makes me, so every time you ask a question about what can Lyme patients do when they pile all of these things on, when perhaps you're not in the acute phase dealing with the microbe, but having that after the fact inflammatory response, because it ends up being so similar. I would have identified those symptoms as everything old coming back, but it was caused by seemingly this new thing. So any type of answer to that, I think, would certainly be helpful to me, would be helpful to someone in the comment wrote, felt like Lyme and Babesia on steroids. I completely agree. It feels like a Babesia flare, where I just still have trouble breathing, all these types of things. And it's tricky. And I think there are questions in there that if answered would help a lot of people.
Can I clarify one thing? Is that I'm at somewhat of a disadvantage when you contact people over the phone or you hear those things, is that you got near the insight that Jennifer had to offer on what she personally went through. What I'm concerned with is that people when they say, "Oh, I'm not any worse than the family," well, how do I know exactly unless I examine that patient? Because often nobody can tell what the other one's feeling. They only see what they see on the surface. So truly to understand COVID, one would need to take some maybe fresh COVID family members and some with COVID and see how they're all experiencing. Because to go from being well to COVID and COVID long hauler, your life is pretty devastated also. Whereas somebody with Lyme are kind of used to losses. They're used to all kinds of limitations on their life. Their health isn't where they want to be. And so they're kind of used to that. So it could be that that this is a topic that we could learn from our Lyme community what to ask, and some insight is how to interview people. I just haven't had the chance to interview them because it's a phone contact.
Yeah, that's definitely extremely interesting, and thank you again for sharing your story here, Jennifer. It seems obvious that there's a variety of different reactions among the quote-unquote immunocompromised community, and that term itself has been used more than ever since the beginning of the pandemic and everything like that. So I pose this question first to Dr. Cameron: is that term immunocompromised? Can you please define it for our audience in order to help continue to guide the proper usage of that term?
Well, I was writing a blog on the topic of immunocompromised because there's quite a few different definitions of immunocompromised. And so it seems like, there's the classic one, which is like cancer, chemotherapy, radiation, but an impaired immune system is often defined as an overactive immune system. And so they both seem to have leaving people ill. They both impair the immune system. There's a lot of variety, but cytokines are part of it. But even Alcott at Johns Hopkins said there's like 70 to 80 cytokines and chemokines that they studied. So I would say basically that there's the broader perspective that underactive, overactive is also lupus, are a problem, and that everybody has their own nuance in how they're exhibiting an immune response. So yeah, they're all lumped together as an impaired immune response. So I think that Dr. Rawls also probably has perspective on how it's defined.
Yeah, definitely. I was actually going to swing over to Dr. Rawls and ask the question: as somebody who may fall under this category of being immunocompromised, what are some things that they could potentially do to help protect their immune system against things like COVID?
Yeah, I agree with Dr. Cameron. I don't really use that term immunocompromised except in application of what chemotherapy does to the immune system, which basically just shuts it down. It destroys it. I typically use the term chronic immune dysfunction, and I think it's important to differentiate between acute infection and chronic infection. That's something I don't hear defined as much as I would like. So acute infection is when a microbe enters the body for the first time. The immune system may have some preparation, genetic preparation for that microbe, but it's the first time it's been exposed to that microbe, right? So we've been exposed to coronaviruses before, we have some memory, but if we get the SARS-CoV-2 for the first time, that's the first time it's entered our body. That's a new acute experience with the immune system. Whereas if you have a chronic infection with anything, it means the microbes are well peppered throughout tissues and the immune system is struggling. It's not having the capacity to keep those microbes in check. And because it can be different microbes in every individual, you do see a range of what this means. And a lot of times it's overactive parts of the immune system, underactive parts of the immune system that are being suppressed all at the same time. So I've come to use that term chronic immune dysfunction to define this. Again, my experience is the herbs, and I tend to fall back to them. So we have antimicrobial herbs, like the ones that I mentioned, but we also have what are called immune modulating herbs. And these herbs are affecting those cytokines. And so a lot of reishi mushroom, cordyceps mushroom, Chinese skullcap, red sage, there are a lot of immune modulators. They tend to pull down, they cool down the immune system of that overactive cytokine storm. And that allows the immune system to basically get it to act together and work better. So I found a lot of value in these immune modulating herbs that we also call adaptogens. There are lots of them. Ashwagandha, ginseng is an immune modulator, rhodiola, eleuthera, huge list of them. But my favorites are probably reishi and cordyceps. The mushrooms seem to have a really nice effect of immune modulation. And we find that these things have a lot of value, but they both have some antiviral properties too. Reishi has actually been looked at for SARS-CoV-2. So when we look at what these things can do, there is some value there that we haven't overlooked. That statement you made about withholding ivermectin, I think you could equally make the same statement about the herbal therapies, because there's such a small penalty for toxicity. And we got a lot of the antiviral properties of these things have been defined with science. So it's not a complete unknown.
Yeah, I really like that term, chronic immune dysfunction. And I think it is a perfect segue into one of the main questions that I know a lot of people are really curious about, which is the vaccine. And I mean, while we know that this vaccine has shown some high efficacy among traditionally healthy populations, Lyme patients definitely fall under that category of chronic immune dysfunction. So and I'll go to Dr. Cameron first. What would you suggest for individuals and Lyme patients for taking this vaccine? And is there a timeline that you may suggest to allow them to see a further efficacy in similar patient populations?
Well, if someone's in the middle of Lyme treatment, especially someone that's relatively new in treatment, I focus on trying to get the Lyme disease under control first, to get their diet under control, because there's an awful lot of people that eat poorly, drink alcohol. They need some counseling. So I do whatever counseling I can to try to get them used to a chronic illness. So when they're facing a vaccine, they're thinking about the vaccine, I want them at optimal health. Sometimes when they're having so much trouble with Lyme, I try to figure out if I can postpone the decision on a COVID vaccine until they get some control over their illness. Then I'm still left with, well, is there ever a good time once you have Lyme? Because plenty of people actually have this immune issues. And that's when I have to really spend some time with each patient, because I do what every doctor does. These are the risks. COVID's bad, especially if you get it or your grandma gets it. That having a vaccine is bad, or at least we've been told it's bad if you have Lyme disease, because who wants to alter the immune system, change the immune system, especially with this messenger RNA where we don't really have any other diseases where we routinely use it. So that's why ultimately every one of my patients has to make a decision. They're all over the map on whether they absolutely won't do it, absolutely will do it. It's a constant dialogue with what they should do, but they at least should get their health back as best as possible so they can time it right.
Now,
Dr. Rawls, same question.
Yeah, I think I'm right in line with Dr. Cameron on that one. And I think his opinions are very valid. There is no right answer. It's just picking the least wrong answer and sometimes that is difficult. It's challenging. I think we'll know more 6 months or a year from now about the vaccine, the different vaccines, of which there are many, and how they're going to affect the immune system. but there's just a lot of unknowns. I'm not an anti-vaxxer. I think there is a place for vaccines, and they've done wonderful things to save us from some really horrendous illnesses. But this one is a hard one to judge, and I think it depends on the person's situation quite a lot. I agree completely. If you decide to get the vaccine, get as healthy as you can before you do, so you can normalize your immune system functions, so that is less likely to cause an adverse reaction. But it's really a choice of, do you want to continue isolation and doing everything you can to keep from getting this virus? Or if you're in a situation where you're constantly exposed, that may push you more toward going ahead and making the decision to get the vaccine. The other side of the vaccine, though, just for the general population, is that I don't think we're going to move past this crisis until enough people get vaccinated. And, with new strains coming out, I was just reading one today that is hitting an Amazon community in Brazil, that they were the worst community, got hit the very hardest in the beginning. So many people got sick that they felt like they hit herd immunity in that very isolated community. And now it's happening all over again with a whole different strain that people are getting infected. And what they're telling us with the vaccine is that it should cover for different strains. So, we could be going around in circles for years and years with this thing. And I think that enough of the community, enough of the world's community embracing it is the only thing that's going to get us beyond this thing.
Well, I can add one more thing just for clarification, is that
Go ahead.
if I weigh the benefits and risk, I wrote a blog recently where I don't think that just automatically dismissing it is right. That one should at least or look at it a second time. There's so many hesitant people on vaccines in general. So, but ultimately, when I have a conversation one-on-one with my patients, sometimes they ask me, "Well, doc, what would you do?" So that's where I come up with, with what I have, and that could change with new information. That's when I say, well, I guess if it was me making the decision, I would advise the vaccine. It's just that there's still plenty of patients who have to make decisions, just because I might say, well, I've looked at my side of the risk and benefit equations, and I've said, let's go for it. So that's why you hear two different answers from my mouth based on what I present versus what I would do if I were in that situation.
Yeah, I think I'm in the same place that, I'm healthy and doing well. I will probably get the vaccine for two reasons: to just set that example in the community that this is something that enough people need to do, that we get beyond this thing, and two, to experience it so that I can tell people, and I've experienced it firsthand if I have a bad reaction, and that would help me counsel people. So that's where I'm leaning.
Yeah, I really appreciate the honesty from both of you on this subject. It's a really tough one, especially for the Lyme community, but I think your guidance is going to be very beneficial in weighing, exactly as you referenced, that risk reward benefit, and how long you as an individual choose to isolate and choose to separate yourself from society. But speaking of society as a whole and their quick acceptance of the idea of a long hauler when it comes to COVID, are there any societal benefits specifically for Lyme patients with the idea of long haul COVID being accepted so readily?
Well, I'll take that one on.
Sure.
Is that certainly cytokines are in the news. Cytokine storms are in the news. Hardly anybody on the planet hasn't heard that that's what part of the problem is. Now, those who know Lyme know that there's so much cytokines, so much diversity in cytokines, so many ways to treat cytokines. I happen to take the role of, if there's an active infection, I'll do whatever I can with an antibiotic or something for Babesia, and dietary work and counseling. But that whole long hauler concept is going to get the concept of chronic illness in the news. Now, as with anything happens, there's special interest groups. So, somebody works with Lyme like myself, that the infection end of it wants to make sure that we understand the long haulers. But the chronic fatigue people say, oh, that's a chronic fatigue issue. So some patients are going to be told you have chronic fatigue, that's all it is. And or the fibromyalgia people. So it's in a way it's being discussed, but you have to be aware that everyone has their own bias, including myself, as what I might do. But still the long hauler will get discussion. Just the buyer beware as to which thing you're going to go on, which disease you're going to go on. Likely, you just have to accept that that's an illness. But you might have another illness that has nothing to do with ticks, nothing to do with fibromyalgia, nothing to do with chronic fatigue, and you're overlooking something. So, but it's in the news, at least, acceptance that there's some chronic issues of some sort for some people.
For me, it's a really big deal that it has opened the door, I think, to people starting to understand the difference between a chronic illness and an acute illness as far as an infectious illness. And so, yeah, I think it's going to open some doors. But interestingly, I read an email this morning that was saying that some chronic Lyme disease sufferers were saying, hey, this isn't fair. We've been struggling with this thing for 30 years, and all these long haulers are suddenly, clinics are popping up and everybody's taking notice. And it's like, hey, but I think in the long run, everybody is going to benefit. It is going to open up awareness. And my hope is that people start seeing that a lot of these things, it's not as much the microbes, but it's the world we live in, that we have so many pressures on our immune system. The bad food we eat, the chronic stress we're under, the petrochemicals that we're exposed to every day, the sedentary lifestyle that we have. I mean, we're living in the age of chronic immune dysfunction right now. And that is something we all need to be aware of, for sure.
Yeah, I really appreciate both your answers on that. And I agree. I think this is an awesome opportunity to make light out of such an awful situation, and especially for the chronically ill community, to take acceptance of and understanding of chronic illness and trying to pull themselves along with all the progress that's being made from a governmental acceptance standpoint, from a societal acceptance standpoint. So I actually saw a question in the chat, and it overlaps well with a question that I was going to pose to Jennifer regardless, is in terms of remission, do you feel that you've been able to hit a point where you would qualify yourself in remission? And in that same stance, would you qualify yourself healthy enough to take the vaccine?
No and no. I have friends who are in remission, and which is beneficial. I mean, I'm happy for them. It's also useful to hear what remission is like for them, because even if that's not universal, everyone's definition might be a little bit different. There are certain telltale signs, and I don't qualify. I still have to spend a large part of every day on my health, and have to take medications and IVs and do certain protocols and eat a certain way. That's not remission to me. I have a couple things I'd like to add. I do think it's really interesting to bring up the difference between immunocompromised and chronic immune deficiency, but I worry when I hear stuff like that as a patient, because though scientifically that may be the case, using different language makes it very difficult for patients to get the help that we might need. I found that in reality, just as the language issue with chronic Lyme, persistent Lyme, and now long haul Lyme seems to mean different things. and affect whether or not people get treatment and if they get the right treatment. As a patient, I don't care what it's called. You could say I have, I'm sitting in a chair syndrome. I don't care what it's called, but I would much rather get the right kind of help. I'd much rather have it be solved. And so from that perspective, the long haul language does feel useful to me because a lot of the symptoms overlap that from my own experiences, my symptoms have overlapped from these things. And if that would add an element of impetus to certain research, let alone just societal relational understanding, I would be very happy. And I did see that there was a question about whether or not I'm going to take the vaccine. And I think that's part of what you were asking. I have been advised not to for now, not because the vaccine is bad or because vaccines are bad. I'm not an anti-vaxxer either, but I haven't been able to take any vaccine for the majority of my life because of my reactions to them. And this feels relevant to the language issue because immunocompromised, immune dysfunction, something's not working, something would go. I wasn't able to launch antibodies to COVID, and it caused problems that appeared in my blood work. So my doctor has advised me to wait to get more information on how certain kinds of patients, whatever you may call them, including people with a history of anaphylaxis, how they react to the vaccines over time.
Cool. Thank you very much. Yeah, I mean, we're very blessed to have people like Dr. Cameron and Dr. Rawls who are on the right side of this equation with being able to accurately identify and truly listen to what patients are saying, regardless of what the words may be. But there's still a lot of people in the community and just in the medical field in general who don't have the type of knowledge that they do. So I definitely understand where you're coming from as an individual who's looking for that general acceptance and hoping that other people don't run into the same issues that you may have in terms of getting diagnosed and getting the proper treatment. So we're very thankful for people like I said, Dr. Rawls and Dr. Cameron, and the hope is that one day everybody will be as well educated and accepting of this as they are. So honestly, we're at the end of our initial questioning. However, as Dr. Rawls and Dr. Cameron, you may be seeing, there is a lot of questions coming in from the community, some very specific. So I want to now turn this over and begin asking some of these questions and give the participants of this webinar the opportunity to have some of their questions answered. So the first is, there's one that is referencing the idea of long haul and and I'll pose this to both doctors and I'll start with Dr. Rawls. What do you think is causing long haul or persistent virus? What exactly leads to that versus the ability to treat and end things in an appropriate timing?
Well, I get what you're saying, Jennifer, but chronic immune dysfunction. No.
I'm more just interested in being able to explain something that people understand.
So
I know what you're talking about.
Okay, there. Okay. So the reason I chose chronic immune dysfunction is because a lot of people are using immunodeficiency or a weak immune system, which implies that it's underactive, and a lot of times parts of it are overactive, and immunocompromise is generally what we apply to cancer therapy. So it just, as professionals, I think it helps us with terminology to understand what everybody is talking about. So that's why to possibly, refine our terms so we all are on the same page. So I think there's value there. But as far as what's going on, whenever a microbe enters your system, you have that initial infection, that acute infection, which is basically a war with the immune system's innate first defenses. But if that microbe can break through those defenses, then it moves toward hitting the bloodstream and disseminating throughout the body. And we see this with Lyme disease, but we see it with a lot of other infections. So you can think about your body, your tissues basically just peppered with microbes. All of these things are intracellular. So the microbe, so if you could think about like muscle tissue or brain tissue where you've got normal cells and then just kind of peppered, scattered about low concentrations of cells that have been infected with microbes. So in that case, the immune system has to use a different strategy that we call the adaptive immune system, that it produces antibodies and sends in targeted immune cells to take out those cells that have been infected with microbes. You always have a little bit of collateral damage, and if you carry in with big guns, you're going to destroy a lot of tissue. So there's always that give and take of how far can the immune system push this thing to eradicate the microbe. So once it's disseminated, it takes a long time for the immune system to take care of that. And all the research is now supporting these things. So there is a little bit of an autoimmune phenomenon with this, with that collateral damage, with all of it. But it does appear that we all do have microbes in our tissues. There were studies 2016, 2017 showing that we actually have a microbiome of the brain. And I'm finding studies that we have microbes in our kidneys, in our heart, and throughout our body in really, really low concentrations. So if your immune system can keep a tab on these things, you don't get symptomatic. But if you have that situation where the immune system has been disrupted, either by microbes or compounded by factors like bad diet, stress, environmental toxins like mold and other things, then the immune system just can't keep the lid on these things anymore. And at that point, it may not be one infection. So in my research with long COVID, I found a study that found that 20% of people that ended up with long COVID actually had co-infections, kind of like like Lyme disease. They picked up other things at the same time. So microbes travel together. They all want to get in our body. So when you have a symptomatic chronic infection, it just means that there's enough microbe activity that you've got increased cellular turnover, enough to cause inflammation that's driving that discomfort, and enough microbe activity that it's throwing the immune system off balance. And the immune system is trying harder. So you get those inflammatory cytokines that drive the inflammation. So often it's not as much the microbes as the reaction of the immune system to try to eradicate these microbes in the body that actually may make for the misery. And once you get that pot boiling, man, it's hard to get it under control. So does that better illustrate it, Jennifer?
Yeah, it's a good way to explain what I'm thinking about, I guess, because to me it seems like, I know this is not something that exists, but like, when does it become a long haul syndrome as opposed to whatever caused it, as opposed to just Lyme disease or tick-borne infections or COVID? Because what you've described is definitely what I've experienced and what I know a lot of other people have too. And I've been given the visual of the cup, and you fill it with enough things that put stress on the body and the system, and eventually overflows. And so I mean, that I would love, as a patient, I would certainly love for that to be explored as much as possible, and for treatments, I mean, beyond this call, for people who are doing research and all of that, to figure out how best to address that situation.
And in my research, I'm reaching the conclusion that we basically all have chronic infections with some microbes. We've got Epstein-Barr, a lot of people have mycoplasma. Bartonella is actually the rate in asymptomatic populations is relatively high. We all have something. So the difference is between a chronic asymptomatic infection and a chronic infection. And I think and once it becomes symptomatic, that's a sign that the immune system just isn't keeping track of isn't keeping a lid on it. But I've been pretty symptom free for a good 8 or 10 years now, and oddly, a lot of things that I was having pretty badly, heart symptoms, joint symptoms. I figured by 60, I'd be having various kinds of joint replacements, and my joints are fine now. But there's always that lingering question of, have I completely eradicated the microbes from my body? And I'm not sure I would say that I have. I still take herbs. I still eat a good diet. I still really take care of myself. But there's so many things out there. There's been studies that everyday garden variety osteoarthritis. I found a study that they did joint knee aspirations of people with garden variety everyday osteoarthritis of aging, and found that 90% of those people had mycoplasma pneumoniae in their joints. So it's so I don't think we can ignore the possibility that these things are present. And so I think part of the recovery process is suppressing the microbes, but also calming the immune system and restoring cellular health. Because what my studies are showing also is that weak cells that have been stressed in the body, are more vulnerable to be invaded by microbes. So I think that cellular health is just a really, really important part of this recovery process.
Let me close that discussion just a second, because what I always get involved with is diagnostic issues as an internist. So I always urge anybody who thinks they have long hauler, told they have long hauler, is they should get evaluated by someone, because whether it's a tick thing, a microbe thing, some other illness, heart, cancer, it's just important not to self-diagnose and to get stuck with that diagnosis. So I always advise people to, yes, it's a thought, it does exist, it seems like it's common, but who knows, it might even be depression. It could be so many different things. It's better to seek out a doctor rather than just assume you have it and it's fatalistic and I'm just going to live with it and not overlook another diagnosis.
Oh, I agree with
and if you had some remedies before that worked, that you've learned from having a Lyme patient, just to do whatever you can to get back as best you can with something that work, but definitely see a doctor.
Yeah, I agree with that 100%.
But at least I think it's better to get seen rather than just give up and assume you have it.
Yeah, no doubt. It's there are certainly things that can be addressed medically, and that should be a key component of the recovery process. Is having a good healthcare provider on your side is really important.
Yeah, I think Lyme patients, we all know, they get a bad rap for what they have, for perhaps being hypochondriacs or whatever. But I think the majority of Lyme disease patients would love to be able to see a physician who can diagnose them properly and believe their symptoms, as opposed to jumping to assume that any of us has a long haul or anything. I don't know too many people who want that.
Right. There's always a question on when they say chronic fatigue or chronic Lyme or chronic long hauler, is that some doctors seem to make a judgment rather quick with anything that's chronic, and they're lumping it into psychiatrist diagnosis, even though they're not psychiatrically trained. And so it is easy to kind of let long hauler fall into that air quote type problem.
Yeah, that makes sense. And I'm sure every single Lyme and or COVID patient out there would not would not appreciate that. I think we've all kind of heard it once or twice, that it's either possibly in one's head, or are you seeing someone to talk about this? Seeing someone to talk about it is great, but yeah, patients need to be believed medically.
Yeah, having been on both sides of the fence, I appreciate that. You know, it's that was what led me to herbal therapy, because I just wasn't getting anywhere. But still, I think that, you know, most anybody that I talk to, I tell them, you know, you still need a relationship with a good medical provider, even if they don't completely understand your Lyme disease, because you don't want to exclude something that is otherwise. And you certainly need connections, sometimes for medication, sometimes for laboratories. So I think cultivating that relationship is important. And even if you don't, you know, have someone that understands Lyme disease, having that relationship is still part of the recovery process. You need that connection. But again, that being said, you know, I ended up pursuing herbal therapy because I wasn't finding the resources that I needed. And that was very frustrating at the time. Retrospectively, it's one of the best things that happened to me in my career, because it put me down a pathway that I learned about things that I never would have learned about had I not had this experience.
So I'm going to follow this up with our last question for the evening, and I'll direct this towards Dr. Cameron, which is in regards to the vaccine itself. Is there any individual test that a patient might be able to take to gauge their health levels before going into actually taking the vaccine, being a blood test or just a symptom checker or something like that?
Well, there isn't a great test for this whole immune system. You know, even though I've been, you know, went through medical school, I thought 40 years ago that they should have it figured out by now. We don't have a tool to exactly measure where your underactive immune system, where your overactive immune systems. So there's a number of markers that integrative medicine have been introducing to look at what's happening in the immune system. I haven't been using them because I tend to pick more on clinical judgment, symptom management, function. And so, you know, that's why I don't have a measure. I know I have plenty of people where they've already know they're absolutely not going to do a vaccine, no matter what the test shows, that whatever their measure is of their immune system, they just know, you know, my job is to at least say, by the way, 30% of Americans in a survey says they don't want to take it, whether they had Lyme or not. So that's a pretty high number, but I don't really have a good blood test. Maybe Dr. Rawls has some test of immune issues that that one could do to get a better signal for where they're at.
As far as testing for immune
Immune
functions,
function and
yeah,
other than that,
yeah, it's again where I'm going with this thing is that I think the chronic microbe thing is just much bigger than we're recognizing. The studies that I'm seeing only over the past 5 years are just showing the potential for the variety of different microbes that can cause so many things that can overlap with Lyme symptoms. And all of these things have slightly different strategies. It was really interesting to read about the different Trojan horse strategies that microbes use to stay alive inside white blood cells so they can use that as a vehicle. I even found a study that suggested that the microbes could steer the white blood cell where they wanted it to go. Really fascinating. But it's different for every microbe. So every microbe that you encounter, and this concept of co-infections, I think is big. I mean, ticks carry hundreds of microbes, and lots of respiratory microbes travel together because that's a great pathway. So different microbes affect the immune system differently. So in a sense, every patient with chronic Lyme, every patient with long COVID, every patient with any chronic illness is slightly different than all the other patients in that group. And therefore, we're seeing a widespread range of what immune dysfunction is. And it makes it really, really hard to test for specific markers for it.
Thank you very much. So as I said, that was our final question for the night. I really appreciate both you, Dr. Cameron and Dr. Rawls, for taking the time to join us this evening. I think this was very beneficial for everybody. You know, it's while there is a lot of negativity that's involved with being in a pandemic and having those chronic immune issues, it's still beneficial to know that there is the opportunity to get healthy again. There is the opportunity to find a way for us as a community to be able to come back together and return to some sort of normalcy in the future. So I'm going to go ahead and put the links for all of Project Lyme's, being the donate, our store, and signing up to our newsletter, as well as putting in my email address for any of those who may be interested in participating in volunteer programs through Project Lyme. Over the next year, we're looking to expand our volunteer opportunities and make sure that anybody who is involved in the chronic Lyme community, or just the Lyme community in general, who wants to be involved and make a difference for individuals, feel free to reach out to me at this email address. And the one last thing I wanted to mention was exactly what Jennifer put in the chat, which is, and I'll let her expand on that a little bit more, but go ahead, Jennifer.
Yeah, I was just wanted to let the people here know that Generation Lyme exists as an initiative of Project Lyme and is a support system for young people with Lyme disease. Although we do welcome everyone who wants to join. We hold meetups multiple times a week, and some special topic ones every month. And it's a community. It's built to empower young people with Lyme disease, and it's thriving. It's an amazing way to thrive while you have Lyme disease, just because you can find and connect with people who get it. So you can find us on Instagram, Generation Lyme, or our new website, genlyme.org. And yeah, you'll find stories there of patients. And I'm sure the longer we go, the more overlap there will be with Lyme and COVID. So as much as we can be here for each other, we try to do that.
Awesome. Thank you so much. And again, thank you, Dr. Cameron. Thank you, Dr. Rawls. Thank you to all of our attendees this evening. And thank you to everybody who is streaming via Facebook Live. Everybody have a great rest of your evening.
Thank you very much.
Thank you all.
Bye-bye.